Hi, my name is Dr. Gekht, and I'm a dentist in Simply Smiles in Sarasota, Florida. So I get a lot of questions about Invisalign or basically all kinds of clear aligners. A lot of people want to know whether or not clear aligners, Invisalign, Candid, or any other clear aligner are going to work for you. If you're going to be a good candidate, if any patients are going to be a good candidate. So I'm here to answer any of your questions. So Invisalign is a orthodontic way to move the teeth using specially designed, customized clear aligners that look like basically clear trays that fit over your teeth. You get clear aligners. They look something like this. So as you can see, they sculpted over your teeth and they go in the mouth like this. So these are the clear aligners. If we compare Invisalign to traditional braces, personally, as a consumer, as a patient, I'd rather have something that is not going to be bulky, not going to cut the inside of my lip, because the wires oftentimes do, and they're going to be comfortable. Results are actually going to be quite compatible. I think there's definitely a lot of advantages to clear aligners, whether it's going to be Invisalign or Candid or any other one. And that essentially is going to make it easier for patients. I think it's better for hygiene because it's easier to clean. And again, people are more receptive. I get that question quite a bit. Does Invisalign faster than braces? In my opinion, it just depends on what we're trying to correct. If it's something minor, then yes, I think it's going to do it faster. Otherwise, it might take just as long. But again, it's the ease of wear and the comfort. That's what we're looking for. And that's, I think, why a lot of patients are choosing Invisalign or any other source of clear aligners. Invisalign considered more comfortable than braces for multiple reasons. Number one is that it's easy to keep your teeth clean, because then what you do is you can take the aligners off and you can brush your teeth just like you normally do. Also, it's easier to eat with. Food doesn't get stuck inside under the braces. And another reason why I think Invisalign, people find it easier to use versus conventional braces is because, again, the brackets, the wires don't rub against the cheek. It's a lot more comfortable. And that would be something that I use. And like I said, that's just an example. Everything really depends on how severe particular situation is. If somebody has rather very crooked teeth, it might take up to about a year. If it's rather minor, it could be as simple as just a few months. And it's just a few months before you're going to get the smile that you always want. Let me tell you a little bit about the process, what we do when patients decide to get Invisalign clear aligners treatment. So the first thing, we have to make sure that the patients have healthy teeth and gums. Healthy teeth, we don't want any cavities. Healthy gums, we don't want to start moving teeth that are ridden with gum disease and stuff like that. That's number one. So healthy mouth is a must. So the next thing, we usually take a lot of study models. We usually use virtual. And in a minute, I will show you what we use to do impressions. It's a lot more comfortable now. So we don't have to use a lot of glue and then it goes all over your face. We use digital scanners now. Then we also take series of pictures to communicate to the laboratory what we're trying to do. Then after that, the laboratory comes up with a virtual simulation, and usually doctor, me or another doctor, checks, make sure that did we get the result that we want. And only then it gets approved. Then in about 2 weeks or so, the set of your aligners arrive in the office, and then we place them in your mouth. Sometimes we need to do buttons to make sure that the trays are sitting there. And then you come in for checkups about maybe every 6 to 8 weeks. So honestly, it's pretty simple, and we've had a lot of success. So I get that question a lot. The question is, what are the Invisalign trays and how many do I need? So the number of trays depends on extent of the severity of misalignment of your teeth and would be the final result that we have. So again, trays look like this. They're clear trays, and usually we have the top and the bottom. This has just happened to be the bottom teeth. You can see them, they're much smaller. And then depending on that, you can have anywhere from 5, 7 to sometimes a dozen or more trays. And again, it all depends how long will it take to get your smile that you always want. Yes, patients required to wear their aligners 22 out of 24 hours, which basically means that yes, they need to sleep their trays. Not only that they need to sleep, they need to wear them during the day. That's very important. The only 2 times that they need to take them out would be to eat and to brush their teeth. If all possible, I would refrain from doing snacks, from getting a lot of snacks, since we want to make sure that things are going to be kept nice and clean. Sometimes patients are not a good candidates for Invisalign. So a couple of things. Patients who have severe gum disease, I would advise them not to use any kind of orthodontic movement before they can get their gum disease under control. Also, there are some cases that are significantly more severe to control, that when we have situations like this, conventional braces is a better solution. Because again, ultimately we want to have patients who are happy with their results. Invisalign could fix the crossbite, but again, it all depends on the particular case, on the particular situation. And I would say this would require evaluation case-by-case basis. Invisalign most of the time is not painful, but yes, there is some discomfort associated, especially when you just get started. After all, we are moving teeth through the bone. Make sure that we're aligning them correctly. But the discomfort is very, very minor, and most of the time, patients tolerated it very well. I get the question sometimes. Patients ask if the insurance can cover the cost of Invisalign. So if you have a plan where you have a benefit that covers orthodontics, then yes, Invisalign also is a cover procedure. Medicaid, for most of the part, I would guess, doesn't cover Invisalign. After all, Medicaid is the insurance designed to help people keep their teeth, and sometimes that is too advanced of a procedure for the patients to be covered. But to be honest with you, I'm not 100% sure. For that, I would refer you to contact your friendly insurance provider. Maybe they can help you with that. Invisalign and the clear aligners, their cost anywhere from $4,000 to $6,000. Again, it ultimately depends how long your treatment is. We in Simply Smiles offer different options for our patients. We offer Invisalign, and we're provider of Invisalign. We also offer Candid, which is again another way of also clear aligner company that does very similar things. Ultimately, what I do in my office is I choose what's best for the patient, and the cost really varies. Here in Simply Smiles, we offer free consultation. And I would recommend for you to come in and let me take a look and see if you're going to be a good candidate. I hope I was able to answer some of the questions you have about the clear aligners, Invisalign. And if you have any additional questions, please call the office at 941-921-4654, and I'll be more than happy to bring you in and do a free consultation where I can actually tell you if you're a good candidate and if Invisalign is right for you.